Now take a look at this drug. This is cefuroxime, this is ceftazidime, this is ceftriaxone, and this is cefizime. What you will notice is that they all have cef in their name. It's simply because they all came from the same class called cephalosporin. But when do I use cefuroxime, or when do I use ceftazidime, when do I use ceftriaxone or cefizime? I think that's what the pharmacist knows that a lot of doctors and nurses don't know about. So let me tell you small. I'll tell you small. Because I saw a comment one time that said that if a particular class of medication don't work, just switch to another class. Let me leave that one for now. Alright, now cefuroxime, use cefuroxime for gram-positive bacteria such as Streptococcus and Staphylococcus. How do you know them? Throat infection. Do you understand? Skin infection. They are caused by gram-positive bacteria. Do you understand? Alright, ceftazidime. This is very, very special. They use it for hospital-acquired infection, especially in infection that does not respond to ceftriaxone, cefizime, or any other cephalosporin or augmentin. You can use ceftazidime. Do you understand? And then ceftriaxone, of course, they use it for serious infection. Everybody knows what they use ceftriaxone for. If you just come on admission, they usually give you ceftriaxone. And then cefizime is a tablet. You understand? It has good coverage in gram-negative bacteria. Do you understand what I'm trying to say? We have gram-positive bacteria and we have gram-negative bacteria. So gram-negative bacteria causes infection like typhoid, urinary tract infection, sexually transmitted disease. So that's when you use cefizime. Do you understand? Why you use cefuroxime for gram-positive bacteria? You can browse these things and you check it. Do you understand? So if you check something again in cephalosporin, notice they have different classes. Cefuroxime is second generation, and then the other three I was talking about is third generation. They all have their advantages. So depending on the kind of infection you have will determine the kind of antibiotics we will use. It's not every time that we use ceftriaxone. Sometimes we use ceftazidime. Sometimes we use augmentin. There's a reason why. That is why it is always expected that you go for MCS. When you do MCS, we will know the particular bacteria that is causing that infection, and so it will be very easy for us to choose which antibiotics that will work for you. Although most of the time, the MCS result will tell you which particular antibiotics to use. I just thought you should know. Thank you for watching, and see you in the next video.